Hello, it's Wednesday. I'm Dr. Devin from Dr. Devin's Wellness Wednesday workshop. Today is episode number 13, and we are going to talk about the conflict of interest in the United States. Here we go. First thing we're going to talk about is the opioid crisis. In the late 1990s, pharmaceutical companies said, here, take these medications. They're not addictive. They're called opioids. And then, guess what? Medical doctors prescribed them over and over and over again. In West Virginia, there was actually one medical doctor in a town of around 1,000 people had over 10,000 opioid prescriptions that just he personally prescribed. It led to the increased prescription of opioid medications. And guess what? They're addictive. The widespread misuse of both prescription and non-prescription opioids. Very, very, very addictive. And then finally, in 2017, the Health and Human Services of the United States declared a public health emergency. What a shock that addictive stuff is addictive and it kills people. We're going to go on to the Food and Drug Administration now. Every drug ever recalled by the Food and Drug Administration was first approved to be safe and effective by the same FDA. We're going to go back to Vioxx in 2004. Merck, the drug company, falsified data that said that Vioxx did not cause heart attacks and strokes. Guess what? Vioxx caused heart attacks and strokes. Dr. David Graham testified before Congress. He said the FDA's procedures and culture made it impossible to adequately investigate drugs, and that crucial post-approval safety monitoring is especially compromised. 55,000 people died from heart attack and stroke because Vioxx wasn't recalled earlier. The FDA knew that it was a problem after a little while, but they refused to recall it because, Merck. When the FDA approves a drug, Graham testified, it is also saying the drug is safe and effective. When serious safety issues arrive post-marketing, the FDA officials' immediate reaction is almost always one of denial, rejection, and heat. According to Dr. Graham, there's a conflict of interest, putting the same individuals in charge of approving drugs as recalling drugs. So the research that was faked from Vioxx, I don't know if you heard, but just last month, Duke University agreed to pay $112.5 million because they falsified research for years and years and years to the federal government. Let's see. British Medical Journal in 2016. The insurance records of more than 19 million American adults and children with private insurance. 7.6 million patients, 40% of them had at least one prescription antibiotic that year, which is fine if they need the antibiotics for medically justified reasons, but 23% of the cases were not medically needed for antibiotics. They were given to people with viral conditions, or conditions that don't respond to antibiotics like a cough and cold. Conflict of interest. The pharmaceutical industry owns Congress. Dr. Rayford Brown, pediatric anesthesia specialist for the UK Kentucky's Children's Hospital. He's also the chair of the FDA Committee on Analgesics and Anesthetics, is openly critic of the pharmaceutical industry's lack of oversight from the FDA. Basically, the FDA gets paid by the pharmaceutical industries to approve their drugs. Despite many politicians and presidential candidates declared speaking out about Big Pharma lately, Brown does not think anything will come of it because Congress is owned by Big Pharma. The pharmaceutical industry pours over $100 million into the elections in 2016. And guess what? Both sides got money. So no matter who won, both sides were getting money from the pharmaceutical industry. So the pharmaceutical industry was the real winner. Ever since the U.S. started allowing pharmaceutical companies to advertise on television, obviously the U.S. drug usage has gone way up and up and up. As of 2009 study by the Fairness and Accuracy in Reporting, every major media outlet in the United States, except for CBS at that time, had at least one board member that at least one board member that was also a board member of at least one drug company. The board members wake up, they go to a meeting at Merck or Pfizer or Eli Lilly or whichever drug company they work for, and then their driver takes them to a meeting at NBC, ABC, Fox, all the major networks, and then they decide what kind of programming is going to be aired on that network. And if something bad happens with a drug, do you think it's going to show up on TV? The board members who aren't pulling double duty can't really be honest and objective because drug companies pay the vast majority of the TV advertising dollars. Over $5 billion, $5 billion with a B, is paid to media outlets. So Pfizer, Merck, Eli Lilly, any of the drug companies, if someone dies or is crippled from a medication, are the board members going to say, hey, let's post that today? Let's talk right about that health report because, someone died from our medication. The studies found that it takes anywhere from 3 days to a full week before the media reports it, if they report on it at all. Pharmaceutical industry pays billions of dollars to hospitals. They pay billions of dollars to medical schools, and they pay billions of dollars to doctors. Here's a website. Let's see. Called ProPublica, and you can look up your doctor. I will post the link to this website below. But $9.15 billion in disclosed payments. That's disclosed payments. That's not the stuff that they don't want people to know about. So it's institutional. It's from the top down. You learn at school, drugs, 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 drugs. You learn at the hospital you go do your residency at, drugs, 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 drugs. And then the drug reps come to your place of business after that, and they tell you drugs, 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 drugs. Here, free meal. Here, take some samples. This is why our drugs are the best. And then you repeat over and over again through the generations. So back to the opioid crisis. The FDA turned a blind eye, let people die for years. Not just opioids, but all medications in general, when are properly prescribed, cause anywhere between 250 and 444,000 deaths in the U.S. That's the third leading cause of death in the United States. Heart, cancer, medication, the third leading cause of death in the United States of America. There's only 2 countries in the modern world, or the industrialized world, that allow drugs to advertise on TV. The U.S. is one, and then New Zealand is the other one. In the U.S., we pay more than twice as much on medication than anyone else in the world, and we are dead last in the entire industrialized world for health and longevity. Because of the opioid crisis, the average life expectancy has gone down for the first time in years. 70% of Americans take one pharmaceutical medication, and out of 20% of all Americans take 5 or more. People put synthetic chemicals into their body, which are these pharmaceutical medications, all the time, and don't think twice about it because a commercial where there's people happy taking the medication tell them to take it, or someone in a white coat says, "Here, take this." When someone says, "Here, take this medication," they just take it. When someone says, "Here, there's something natural," well, let me do my research first on that one. Because it's been around for the entire history of humanity and people haven't died from it yet, but you're going to be the first. But I'm going to cool down. I'm usually nice, jovial, friendly, and happy. I'm not saying all medication is bad. The U.S. medical system is really great at emergency care. We're probably best in the world at emergency care. You get in a bad injury, accident, they patch you up, they get you fixed. We also have the best 5-year cancer survival rates in the world. So, kudos to us on those 2 things. But if you remember from the first few episodes, the World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. The American medical system sucks at that. sucks big time. Because an ounce of prevention is worth a pound of cure. So my tip for this week, I'm not telling you to get off any medications, just to make that clear. I want you to look at your list of medications. Are some of those medications being taken to counteract the side effects of other medications you're taking, which is very common? Go to the link I'm going to put in, find out how much your doctor receives from the pharmaceutical industries, and then sit down and have a talk with them. So I'd like to thank you for coming on, for watching our video. If you could like, comment, share it, that would be great. Have a good day. Bye.